Do you find yourself clenching your teeth, grinding? Do you have headaches? Do you have a hard time opening and closing your mouth? Or if you're chewing for long periods of time, you feel exhausted. Like I said, do you get headaches, migraines? There could be a lot of symptoms associated with what we're going to be talking about today. If you have, um, if I've said something that sounds like you, like maybe you grind your teeth, you don't even know that you're clenching your teeth while you're working or concentrating or focusing, chances are you could have a condition called TMJ, which stands for temporomandibular joint. And what if I told you that if you had like this random pain in your body, like maybe your hip or your knee, it could be associated with your bite being off as well.
Mhm.
Well, today we are talking with my favorite dentist, who is my Swiss Army knife, Dr. Claire Stagg, DDS. So she has taught me so much that it's not just the mouth, that it's all connected to our entire body. So today, class is in session, so get your pen and notebook out because we're going to learn and grow together. Are you excited? I am.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach and a shoot. What did you do to me, lady? Okay. Okay.
Mhm.
Hi, my name is Lillian McDermott. I am the host of the Lillian McDermott radio show and a certified life coach. And if this is the first time you're tuning into the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Well, this topic today is very personal. This is a very personal year for me. And the reason why it's a personal year for me is that I'm taking the time for myself to love myself and do some of the things that I haven't done. And one of the things that I haven't done is take care of TMJ. This is the temporomandibular joint, which, by the way, at the age of 24, and guess what? This is the year 24. At the age of 24, many, many years ago, I was told I had TMJ. And since then, I have worn a splint religiously at night. There's not been one night where I haven't had a splint or a guard in my mouth before going to bed. But when you meet someone like Dr. Claire Stagg, she lets you know that's a Band-Aid. That's a Band-Aid. So we're taking care, we're ripping off the Band-Aid and we're doing something about it. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Claire Stagg is here to do just that. Welcome back, Dr. Stagg, to the classroom.
Thank you, Lily. Thank you for having me. I'm sorry I interjected. I'm just so excited to be here too.
No, that's going to be deleted. Don't worry about it. No one's going to know about it. So just now. But no,
Okay.
this is really powerful information. This is something I haven't told you yet. Um, right now I'm doing the class without my splint, but I will put it in for a little bit once we start talking about therapy so that you see it. I've never done therapy. I've always done a Band-Aid. I didn't know I was doing a Band-Aid, and I've had pains all over my body, and I've gone to the chiropractor and it comes back, or the alignment on my C1 doesn't stay. It comes back to being out of alignment. But since I started wearing, and I'll show you what these are, these little things right here, this is my nighttime, which when I saw it, I thought I was going to look like Alien. And then this is my daytime splint, which makes me sound like Sylvester the cat. I'm just saying right now so that I don't want to get any letter saying, hey, you
Black.
sound funny. But anyway, so let's talk about this. Let's talk about TMJ, what it is, Dr. Stagg, and why it is important to do TMJ therapy in order to help the body. And I'm going to share a little bit about my progress as we go throughout, but I would like for you to share a little bit about TMJ and how to recognize it.
Okay. Where to begin, right? It's actually called the great imposter in the dental field because nobody knows how to deal with it. And it takes a fine mind to understand how it's all connected. The biggest thing to do is diagnostics. You got to figure out what's going on, how it's connected, what is not connecting, and what is loose and what is too tight, what is not working correctly. So a little bit of anatomy. I have my skull. All right. So let me know that you can see it okay, Lily?
Oh, yes, I can
Yeah?
see it. I can just see
All
it
right.
fine. We're going to call him Scully.
Oh, good, because I usually call my skulls Fred.
Okay.
All right. So basically, so if you look at it like this, if you will, all right, this is the temporal bone. This is the mandible. All right. Hence temporomandibular joint, TMJ. So if you will, this right here is just in front of the ear, which a lot of people think that they have ringing in the ears or earaches or things of that nature. But if you look at it, I'm going to try and anchor this on my shoulder. This right here, there's a little disc right in here. See that? And when that moves, that's why you end up having a click or a pop if that disc is out of place. So you can have a disc displacement with reduction, which means you get back on the disc, or a disc or a non-reducing disc. Anyhow, long story short, the goal is to always have this little disc between this bone and this bone. Because like you said earlier on, if your hips went clunk clunk, that's not normal, right? If your joints, any other joint in your body went clunk clunk, that's not normal either. The other thing that's fascinating is that this is the only bone in the body, all right? The only bone in the body that has two joints, all right? Okay, that form the same bone but have two different endpoints that encapsulated but are affected by 32 other endpoints, which are the teeth, which is why us dentists are so important to this out. You asked about nerves. The auricular temporal nerve is a little fine tendril of the fifth cranial nerve, or the trigeminal nerve, which is the largest cranial nerve. That trigeminal nerve forms anastomosis, or think of it like little drops that form of condensation. So you have the fifth cranial nerve, the seventh cranial nerve, which is the face, if you will, the ninth, which is the glossopharyngeal, the 10th, which is the vagus nerve, which goes all the way down to your intestines, all right, which can also lead, for females, could be the orgasm nerve, and the 11th, which is the spinal nerve, and the hypoglossal. So usually the 5th, 7th, 9th, and 10th, which is why when we do an oral appliance, Dr. Stagg has shown that actually treating the joint with an oral appliance or an orthotic, which will reduce the disjointedness, so to speak, or the imbalance of the bite. And if we were to make the bite level again, we could actually affect Tourette's disorders, for example.
Wow.
And as you know, you wanted me to talk about this.
Yeah.
And I remembered that when we make you level, we can make you walk straight again. That's what my master's thesis was on. When Lily, we could talk about your case, Lily?
Absolutely. Absolutely.
Okay. So when Lily wears an orthotic, and I'll go ahead and I'll show an example. This is an exaggerated version of what she has in her mouth, is just to show it. So this is a daytime orthotic, for example. All right. What it does is it goes ahead and it bites down. I have these two. I'll go ahead and I'll show this. This will be easier. I'm sorry. I'm leaning over because I had everything put to the side. So this is a lower orthotic. So this is what happens. See, there's a little piece of plastic right in there. And what that does is it compensates for that lack of levelness. All right. But that is basically what's in here, and that when that is level, it helps change that joint anatomy and structure and everything. And because that nerve is in there, C5 for temporal, that the trigeminal nerve, that is a massive nerve. So we are neurobiological engineers. By changing the way that your teeth come together, we could change many, 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 many things in your body. And that's just the tip of the iceberg.
Well, I want to add to that, we started this process a while ago. And I think it was in May 23rd, I got my splint. Prior to May 23rd, I was having some hip and knee pain. And as soon as I started my therapy, my hip and knee pain went away. Coincidence?
Aw.
I don't know, but I haven't shared this with you yet, but I want you to know that my hip and knee pain went away. Now,
Cool.
and so what Dr. Stagg was talking about is when she had me, this was on the 23rd, and again, I had 3 or 4 days later, I went back and she tested me again. When I walked with my eyes closed from one point to the next, without the orthotic, I was walking slower, I was stumbling a bit, and this is with my eye closed, and no drugs or alcohol. So I'm just saying I am completely sober. And so nobody can say anything about that. So I'm just ruling things out. So straight line, and it took me longer. So then she had me go walk the same line. I put the splint guard in. I was faster. My step was sturdy, and I stayed straight. If you would have seen me without the splint, you would have thought I was having a drug test, and I just failed it. So,
Yeah, you were
but
wobbly.
I was wobbly, and with the splint, and it allowed me to go straight and have a strong stride and
Gait.
faster. Yes, a gait. And I was amazed by it. Now I'm hearing all these things about, TMJ and the body, it's all connected, and I understand that and I believe it. But until it happens to you, until you experience some of the benefits from this, it becomes real and it becomes doable. Like I can, and I remember, because of all these splints that I've been given in the past, and I don't know if you've seen a difference in my teeth. I just removed the splint prior to class today. I will put it on later, but I don't want to sound like Sylvester the cat too soon. And so when I started wearing the splint at the age of 24, it basically kept me from grinding my teeth down to the core. But explain what this therapy is doing now. I mean, you shared about the joint and how it's making it even, but how is it making it even? What are you going to be doing with this guard as we go? Because I go from this guard, which is what I wear at night, and I wear it this way. I don't know if you see the little hole there. That's where my tongue goes, by the way. They're teaching me how to reposition my tongue when I sleep. And then this one, when I wake up in the morning, I take this off and then I put this one on. I don't know if you see the little silver beads that are in there. Let me see if I can get this. I don't know if you can see the silver bead. I think this is a good, yeah, there we go.
Those are little arms, little clasps to hold the
Yes.
appliance in.
Yes, and I'm going to need an
Lily, I
adjustment.
can show them on the
Okay, perfect.
on the model.
Perfect.
So this is going to be, I'll do a simple anteriorly program, and Lily's asking a very pertinent question, by the way. So I'm going to explain this a little bit succinctly and very easily to explain the difference between the average orthotic or appliance or splint compared to an orthotic. All right. So let's say you go to a chiropractor and you quote unquote have a short leg. Well, that's very rare to have in the first place. Shorter limb usually means that the hips rotated, just so you know. That was part of my research. They're very, very rare to have shorter limbs other than a surgical accident or an issue. But when you do have a shorter leg, the quick fix, the band-aid is let's put in an orthotic, a Dr. Scholl's orthotic in your shoe, right? And then poof, you're back. Doesn't mean that your hip's still not rotated, unfortunately, right? So that would be, it could be what we would call an ascending issue, where the issues are at your feet and they go all the way to your neck and then to your mouth. And people could walk in the office with a bag full of splints and say, you're not going to make me another splint. Well, it was never really the joint that was the issue or the bite. It was really the feet that were the problem from the very beginning. That's a side thing. Now, if you do have a descending issue to where your jaw joints are what we would call TMJ primary, then that's where we go ahead and determine what can we put between your teeth that would reposition the jaw joint. And that is what I think is the big disconnect between all the splints you've had your entire life, which were just pieces of plastic between the teeth, and you still ground them down, and they were never level, and they never really therapeutically reposition that jaw joint in such a fashion that that nerve went
I know. Yeah.
and that's what occurs, because if you two things, if you get that joint repositioned in the right way structurally, the nerve part, that's where the circuit just shuts down and goes in sympathetic as opposed to sympathetic mode or fight and flight. It just goes to normal. All right, let's do the in between parasympathetic and then sympathetic. All right, but you have that neural aspect. The second aspect that's super important is the structural aspect, because once this is right where it needs to be, then that affects the atlas. So I always say, think of the axis of rotation of your bite. Like, think of this as a seesaw, all right? You're used to seesaws being like this. Well, actually, it's like this being all your teeth, this being the atlas or the fulcrum, this being the rest of the body, all right? Well, which side do you have the baby? Which side do you have the sumo wrestler? If your jaw joints are off, all right, then this whole thing is the sumo wrestler. It's going to throw the whole body off, which is why a lot of times people who have a TMJ disorder have massive neck problems, reverse curves, also have curvature issues, sometimes even scoliosis or kyphosis or hyperlordosis in their spine, and or hip problems and or knee problems and or foot problems, right? So the whole idea is to get the baby, if you will, level and let the spine do its job. So when we get that orthotic as opposed to a splint, we never say splint in the office. It's always an orthotic. The orthotic is a therapeutic appliance that is created specifically on a certain articulator. So we have special tools that level you off at a certain vertical, at a certain, so it's 3D, if you will. So sagittal would be side to side, vertical, and transverse. Now, your therapy right now, because you chose to start this way, was what we would call a static approach, to where we're getting rid of the symptoms. We're stabilizing you. All right. But look how much you've progressed already with this type of therapy. Usually this type of therapy lasts up to 90 days because standard of care says or shows that after 90 days, this is stable, but then this starts to grow. All right. So now we're going to have irreversible changes. Sometimes they're wanted, but if you're not prepared for them, then it kind of throws things off, right?
Yeah.
But just the same way, when you fall and you break a leg, you put a cast, and then to get those two bones lined up together, and then you wear a crutch. That's exactly what your appliances are doing for you right now. It's the cast and crutch together. So during the day, you have the one that makes you level, all right? And it positions you differently This is the one I already took it off, the lower orthotic. So this is the one that positions you differently during the day. All right. This is the one that will get you 3D to where, like Lily said, you can walk, but this is when you're erect, as in standing. All right. So what happens though when you lay down? Your whole dynamic changes, right? Because now your head goes back, your jaw goes back. So what we're going to do now is we're going to actually make one, which is a nighttime, which is going to have a special little pad right here. And this will stop you from clenching and grinding. Notice how there's a space between the front and the back. Well, some of them have it to where you cannot go back. That's a little too far. So some of them have it to where, like we showed with Lily with a little pad, so when you bite down, you cannot go back. So it'll stop you from going back. And that actually not only repositions the jaw joint, but it opens up the airway. So there you go. So now you have a daytime version of being stable and a nighttime version of being stable, which is what Lily was explaining, that she has two orthotics because they're therapeutic appliances as opposed to having a piece of plastic. They're not pieces of plastic.
Hey,
So you're doing a good thing.
yeah, I bit through every single piece of plastic that I was given from the age of 24.
Right.
Some of my splints, and I'm not even going to call it an orthotic. It was a splint because that's all it was.
Right.
You know, I had for 12 years, and eventually I would crack through them. But let's talk about the symptoms, because I mentioned some things like that I wasn't even aware of, like the walking with my eyes closed, and how my gait is different, the direction where I head in. I wasn't even aware of that. Yes, I knew that, especially as I was chewing, I was getting tired, I was getting headaches, and I was beginning to blend my food because it was just too much. Now, keep in mind, I know that there are people that are exponentially worse than me. I like to nip things quickly. And as soon as I start seeing symptoms that, especially in the past, before I was diagnosed with TMJ, it was pain all over my body. It was headaches. It was exhaustion because I wasn't able to sleep very well at night. And I was told when I was 16 that I was grinding in my sleep. My aunt spent 3 months at our home, and of course we shared a bed together. And she said, "You know, you grind your teeth." And I'm like, "Oh, I did not know that." And so I didn't think anything of it until the age of 24, when I was told, "Hey, if you don't do something about this, you're not going to have teeth as you get older." So I've done things that are minor and minimal, but I didn't know I could do more. And that's why we're doing this class. So what are some of the symptoms that one might experience as a result of having misalignment of the jaw or TMJ issues?
All right. You're really asking me to condense whoosh into like teeny little
What
bite
are the top,
pieces.
let's just say the top 10, for example.
All right, remind me to get back to the walking straight thing, because
Okay.
that's unheard of in any field, period. That was my master's thesis, that we did that research. So it's not out there.
Well, I will tell you that I am in the process of also doing neurofeedback with Dr. John Silva. And I was telling him about this, and he goes, "Oh, it's good because it's what it's doing. It's bypassing this." And he was telling me he understood why this was working. And I said, "I'm
Yeah,
going to introduce you to Dr. Claire, because the two
yeah,
of you would be able to work with one another." So
right.
let's talk a little bit more about the symptoms, and then we'll go back to the walking.
Sure. Okay, so let's go ahead and divide it like in the book. My book, Smile. You'll have structural, right? Yay, good for you. It's all connected, so it's all in there. And the beautiful part, and it's very simple, because you could take the book and methodically answer the questions, because we go each body part. So you'll have the head, the neck, you'll have the teeth, you'll have the jaw joints, you'll have the tongue and the tongue space, then you'll have the airway, nasal and so upper and lower nasal, upper and lower airways. All right. So to answer your question, all those body parts will have different symptoms. All right. Depending if it's structural, chemical, mechanical, functional, emotional, or spiritual, hence the 6 petals in the flower. So that's why I'm saying you're trying to condense this whole encyclopedia into just a couple things.
Sure.
All right. So
Let's
let's
just dip
talk a
our
little bit.
toe. Let's just dip our toe. I just want
Let's,
people to understand that, they're going to the doctor. They have a
right,
symptom. The doctor gives them a pill for that symptom that has nothing to do with that pill. And then that
right,
pill creates another symptom.
right.
And then they forget the
All right.
fact that the original symptom that happened.
Okay, so let's go ahead and let's talk about, we'll tackle it from different points of view. So structurally, you're going to end up having all this tension in your cranium and in your skeletal system. Remember, we talked about how it's all connected bone wise, right? Ascending, descending. All right. Chemically, it's going to throw your chemistry off because more than likely you're not breathing the right way. All right. So chicken and the egg. Do you have an airway disorder or do you have a joint disorder? All right. Mechanically, all the foundational concepts of mechanics, whether your gait and your function mechanics, there was a hard toss up between the two, with separating the two. And then emotionally, you're going to be overwrought because you can't function because you're in so much pain. And that would be one of the biggest things is pain. I'm assuming that a lot of people are told that they have to live with it because nobody can do anything about it because it's all in your head. Well, yeah, it's all in your head, but in a different way. And that's what we go ahead and say, all right, it is all in your head, but let's make it to where it's level so it's not causing you all these symptoms. All right. So one of the biggest things, and this is where I think your splint, your orthotics, to call them the right thing, yours are different because they affect your airway. Big, 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 big component. The other ones, and they still teach this in school, is everybody makes a flat plane splint. So in effect, you're still clenching because you have no deterring factors to stop the clenching. All right. But you're not anatomically repositioned to neutralize why you're clenching. And I think that's where the orthotics, the way that we actually make them or have them made for you, it's because it's now a physiologically more stable position. That's the treatment as opposed to the band-aid where a piece of plastic, you can go on Amazon and get a piece of plastic, right? It will not have the same effect. If anything, it can even have a detrimental effect because you're going to be pushing your jaws up and back maybe, or even backwards to where you're not breathing as well as you should, which is why don't mess with the good stuff. Do it the right way. If you're going to spend the money, find out exactly where the hiccup is, where the hang up is, what the issue is. It could be mechanical, functional, neurological, could be any body part, but the whole idea is to figure out what is the root cause of the issue, and then you could focus in on which appliance. You were pretty overwhelmed when I gave you different options, remember? All right.
Yeah.
So you said, I can't deal with this. It's just too much. And I said, okay, doing nothing, or you could do a static approach to where you won't get worse, or you could do a dynamic approach to where we could actually grow your box, if you will. So you handle several things at the same time to where you could develop your arches, develop tongue space, and reposition the jaw joint at the same time. Normal orthodontics do not take the jaw joint into consideration.
Wow.
All right. They are focused on this. They are focused on anything that goes from here to here to this. That's it. All right. When we do, I'm trying to hold it because I can't. It's the whole thing. It's the whole thing. And it's the whole thing all the way. This is my other Fred that has, remember I came to your conference and I had this one?
Yeah.
All right. And actually the chiropractor didn't have one, but I did. Why? Because I affect the entire system. If I go ahead and I put an orthotic right in here, the way that this changes, it's going to affect the jaw joint, but it's also going to affect the atlas. It's going to affect the neck, which affects the entire body. All
Well,
right.
I
Which
will tell
affects,
you, I
which
will tell
affects
you,
the airway, which
yeah,
affects the airway.
yeah. You
Go
had
ahead.
mentioned reverse curvature of the spine
Correct.
and then of the neck here. I have reverse curvature. I have a little bit of scoliosis when I was about 20% when I was young, diagnosed with scoliosis. I've been grinding since I was a little girl, so that I know of, 16, that was I was told, but I'm sure before that. And I am wondering, and I'm curious as to what it's going to do with the curvature of my spine. Will this therapy cause my spine, my cervical spine, to go back to normal? Could this, or is that too
So
much?
you need you need to work with a chiropractor who gets this. They're very few and far between.
Mhm. Okay. Well, I think that we can create, I think I can create coming together of the mind, because, it's not one without the other. That people talk about creation and also they also evolution. And when you look at evolution without creation or creation without evolution, there's huge gaps, but somehow they stand alone. I think that they could be used together. Chiropractic and dentistry, you are closing this gap, is what I'm seeing, Dr. Stagg, because there are, people might have a symptom of pain. Like, for example, something as simple as my hip started to hurt as my symptoms were progressively getting worse. Now, keep in mind, I did a lot of testing with Dr. Stagg. We talked about that, I think, in our first class that we did together. I did a lot of testing. Dr. Stagg was sure that when she gave me lots of options that I could go through, but I thought, I don't want to commit to 2 years of therapy. I was okay committing to 3 months, and then after 3 months committing to maybe another 3 months, and allowing me to kind of dip the toe. And perhaps maybe this is you. Maybe you have a pain in your body, or headaches, or you have a problem with opening your jaw or closing your jaw, or shoulder shoulder pain. That's true. So there may be some things that no one's ever brought this up to your attention, like Dr. Stagg did. Excuse me. And that is
Yes.
why, thank you. And that's why, I love Dr. Stagg so much, and I wanted to do this class. So for those of you who want to learn more about Dr. Stagg, I encourage you to go to whenyounneedafriend.com. And when you go there, you click on your blog. Please subscribe, because if you're a subscriber, now you are going to get the blog with all of Dr. Stagg's information. So this Sunday, you got a blog, and what you do is you check out all her information. It'll take you straight to her website. I am doing this because since I was young, I was told I had TMJ disorder. But what do you do with it? Most people don't know what to do with it. How wonderful that Dr. Claire Stagg does this all together. So go to whenyounneedafriend.com, check out her information. Also, while you're there, please subscribe, like, and follow me on all social media. Support our sponsors like Dr. Stagg. Support them the way that they're supporting the classroom. Make sure that you share this video, share this information, because there might be someone that is in pain and suffering, and they don't realize that their jaw is out of alignment, that their temporomandibular joint is out of whack. There's so many different things we don't know. So that's why I wanted you to take out your paper and pen, because it is so important that we be our own MD, our own medical detective. So support our sponsors the way that they're supporting the classroom. Also, you can go to my Shop Now bag And in my Shop Now bag, you can get Lilly approved products. Check it out. Some of these are affiliate links and they help out the classroom, and some of them are not. So just go check it out and just know that if it's in my Shop Now bag, it is Lilly approved. Then last but not least, you can become an enrolled student in the classroom, whether it's $1 or $1,000 a month or a one-time donation, whatever the case might be, whether it's your time, your talent, your treasure. Sharing this video alone is a great way for you to support the classroom. Writing a comment, putting an emoji on there, that is for you to ensure that the algorithms won't gobble this information out. Because if you're in pain, why not take pain medication? Not here in the classroom. We do everything we possibly can to make sure that you do everything you possibly can to reverse the condition before you put a Band-Aid over it. So today we have Dr. Claire Stagg in the classroom. You can find her at healthconnectionsdentistry.com. That's healthconnectionsdentistry.com. You can also find her at smileprofessionals.com, but healthconnectionsdentistry.com. I'm excited that on July 17th at 7 p.m., because you might have some extra questions, and we could possibly do this as well with Dr. Stagg, where we have a private meeting with the classroom and we can do a Q&A with Dr. Stagg. But on July 17th, not only is she going to be on at 7 p.m. on YouTube, and her YouTube channel is Health Connections Dentistry, you will be able to ask her questions. And not only that, she's going to be giving away a book. So for the people that show up to the event, you will win a chance to getting a free book. I don't know what the details are. I think Dr. Stagg could tell us, or Vanessa can tell us later on, but these are ways that you can take your health back. You invest in yourself, and Dr. Claire will invest her time in you as well. So share a little bit about what's happening on the 17th of July, Dr. Stagg.
I wanted to say, because I'm going to forget, that the joint disorder could happen whether you have teeth or not.
Oh,
So
as long as
when
you have a
were
jaw, as long as you have a jaw.
hopefully. So a lot of people who have dentures, and this is a big fallacy, they think that once they get their teeth taken out, they could have dentures and they're set for life. Well,
Ooh.
soles of shoes wear off, and you'll see that they could be either those wear on one side, the inside, or the outside, right? Well, that affects your hips too. So it's like a chicken and the egg thing. What's wearing off? The hips are wearing off the feet shoes, or the shoes are wearing off the hips, which are affecting the joints, which are affecting the bite. So invariably, if you think you have dentures and they're supposed to last you forever, they don't. The usually standard of care says every 5 years. At least that's what the American Dental Association and the insurance companies think are the norm. But again, if you have dentures made, remember, they follow the fluids in your body. So if you lose weight or if you retain a lot of water, they won't sit as well. And that's where you have the right vertical and the right levelness. So that I think is very important, because I know you have a very widespread audience. And that I think is really important, that people understand that dentures are not an end all be all solution. Once their teeth are taken out, you don't get one set of dentures. Invariably, you would probably need to have dentures adjusted. Sometimes patients who have dentures, they come in, I literally rebase or re-stabilize the dentures on my articulator, and I make them level, and I let them use their old dentures as orthotics for a couple months, just like TMJ therapy. I do the TMJ therapy with their dentures, and then once they're stable and they're out of pain and they don't have their neck and back and issues anymore, and they're good, then we make them new dentures to where they're now level. And sometimes I got joints that are like that. One side that's like 3 or 4 millimeters higher or longer, or worn down on the ridges. So it's really a fascinating thing when you consider that this can go for anybody, no matter what age. And we also do it on the children. So you have children already. I don't know if you knew, but I was doing a sleep pediatric sleep residency. You got little 3 or 4 year olds who already have joint dysplasia or who have joint disorders, and it's really sad because they're losing bone in their condyles at 3 and 4 and 5 and 6, and then they're not level and they can't breathe. So yeah, it could be any age. You're not cray cray. It's definitely an issue that is resolvable. You just got to know what you're looking at. Okay, you were saying on July the 17th, is that
Yes.
where we were?
Yes.
All right,
Very
well,
good.
I'm open to ideas. It would be really helpful if people were to go ahead and to email at PR at Dr. Claire, Claire, Stagg, STAGG.com. So PR at drclairestagg.com. Send in your questions. It would be really nice to have a flow because, as you can tell, there's a whole body. All right. And there's so many parts and it's all in here. I can talk for hours on end. But if I had a flow, we can connect as many dots per body part. And that would have, it'll be more enjoyable, and I think people would get their concerns addressed more easily, and it'll be a lot more fun instead of winging it, crazy
Yeah, yeah, it'd
all
be
over the
nice.
place.
Yes, and if she said the email is PR, that's as in public relations, PR at DR as in Dr. Claire Stagg, that's STAGG.com. If you send your emails there, or you can send them at lily@whenyouneedafriend.com, and I will forward them
Forward
to
them, sure.
Vanessa and Dr. Stagg. This is an opportunity for you to determine, could this be my jaw? Could it
Right.
be? And I spoke to my chiropractor. We're not going to talk about my chiropractor right now, but I spoke to my chiropractor and I said, I wonder if my C1 doesn't stay steady like my husband. She's like, oh, Robert's C1 is so wonderful. And I'm telling you, his C1 stays alignment longer than mine. I could go maybe a couple months, it's out of alignment again. And I will tell you, I was clenching on my my splint guard to the point where I believe it has changed my teeth. It has changed
Mhm,
my bite. And
mhm,
when I started going to Dr. Stagg and she was talking about blocked airways and not breathing right and all of
mhm.
that, there's a test that she does where she tests your breath and how it flows out when you're breathing. And then she did it and compared it to when I had my splint at night, which was my night splint, which is this one. And it was incredible, and how much air comes, there was a bigger flow. Can you explain that, Dr. Stagg?
Sure. So what happens is, remember we talked about the tube. So if you look at it, and this is a really good little demo. I don't know if your clients are watching this also.
It's
I've
sideways.
tried to not get the glare. So when you lay down, in theory, you're supposed to breathe through your nose, right? But a lot of people don't. They unfortunately are mouth breathers. Well, there's two things that happen. One, we create nitric oxide through our sinuses at night, which keeps our vessels supple. So you want to be a nasal breather. But if you're clogged for whatever reason, like you have what we call upper airway resistance syndrome, or you have a nasal valve collapse, then you're not getting that breath through your nose and you end up mouth breathing. Well, regardless, no matter what, the jaw slips back, which is why a lot of times the option for doing the mandible advancement appliance, what it does is its goal is to bring the jaw forward to open up
Can
the
you put
airway.
it sideways so that you have it? There you go. Put it out. There we go. Perfect.
All right. So this is where you have, I'm trying to not get the glare. Is that better?
That's
So
okay. That's good.
this is continuous open airway therapy, but that is an oral appliance, which is recommended for mild to moderate sleep apnea. The problem though is that this treats as the symptom and not the cause. All it's doing is protracting the lower jaw, and all it does is it just keeps this open for as little time as the inflammation doesn't kick back up back here. See?
Yep.
Does not affect the jaw joints. Notice they totally don't mention the jaw joints here at all. Now here, this is for continuous positive air pressure, which is the CPAP. Well, that treats the symptom of severe sleep apnea. These are all treating the symptoms, not the causes. So your question was how to go ahead and to treat airway.
Yeah, what
So
is the correlation between the airway and having an orthotic and helping you breathe?
Okay, so the pharyngometer, which is what you were on, actually is an acoustic device to where we actually can quantify the amount of volume by the acoustics that's in that tube. When you have a collapsed airway, it's going to struggle. You're going to struggle coming in, you're going to struggle coming out because it's collapsed. It's inflamed and collapsed. It's very soft and wobbly. This is a really good 3D printing, if you will. This is really cool. This is a before and after. Look at the difference of
I
therapy.
don't know what you're showing me. What are you showing
This
me?
is the tracheal, this is the pharyngeal airway. This is right here.
Okay.
This is before therapy. Now this is the dynamic approach to opening up the arches and opening up the airway.
Okay.
This is before. Notice how narrow it is. This is after.
So it makes
It's
it
pretty
thicker.
cool.
Yeah, yeah.
Right. Well, actually, it's a
But that one
massive.
has a hole. Is that a hole or is that
It's a 3D print. It's a
Oh, okay.
3D print out of the same airway pre-therapy and post-therapy. No airway, airway.
Very good.
Can't
Okay.
breathe. All right.
Okay.
So the question you were asking is how does it again, TM joint and airway is you can't disconnect the two because it's chicken and the egg. Which one causes what, right? Well, if your jaw joints are up and back, your airway is going to be closed because everything is back, right?
Mhm.
There's a really cool little video on YouTube called Airway and TMJ. It's a little animation. It's 3 minutes long. I have every single patient watch it because it explains everything in 3 minutes. It is so cool. And I think it would be an amazing little adjunct if you can add that. It's on my website, but if you could put it on your podcast, Lily, mwah, I think it'll be really helpful. They could see the anatomy, they could see the joints, they could see the muscles, they can see the collapsed airway, and they'll get a gist of everything to understand the reasoning, how it's all connected.
Yeah, yeah. Okay. So I wanted to ask you, and maybe I'm recalling this incorrectly, but I remember a couple of my friends, maybe even 3 of my friends, that in my lifetime have had to have their jaw broken because of TMJ, and they had to have surgery. I'm trying to, I thought it was TMJ. Is there a reason to have surgery with TMJ versus therapy?
So that was option Z in my report, where it's always if it's even an option, it's always the last desired outcome. My take on the whole thing, which is why I started my journeys, because I didn't want my child cut open. So there are ways of treating this. I think the sooner that you get somebody who knows what they're doing that can help you, the sooner you do it, the better. You don't go walk around with a broken leg expecting to get better without seeing somebody who can put a cast, or you even put a sling on. You know what I mean? You do something to aid the healing process. So it could be a muscular strain, it could be a actual fracture of your leg, it could be anything. You could have strain, sprain, it doesn't matter. It could be a tendon, it could be a capsule. There's so many moving parts in the jaw joint. But to have jaw joint surgery, it's always the last resort. Always, 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 always. My humble opinion.
No,
My
I
opinion for
understand,
what
but
it's worth.
and you know, and I think about it as I was reflecting on what I've gone through so far. This is so much easier than being cut up and my jaw shut closed, and that was what was proposed to them. And I believe they had, is that an option for TMJ to have your jaw cut open and shut your jaw shut so that you can't move your jaw. I remember these people could only drink supplements, you know, like water and everything was pureed. To me that just seems so drastic and barbaric. But
How
that
did it work
was,
out?
I have
How
no
did it
idea.
work out for them?
I have no idea because, you know,
It
at the
would,
time, you know, it was one of those things where, hey, that was the only option. And that's why I wanted to do this class today, to think about how much impact my jaw being out of alignment has created in my body. I mean, my left knee was hurting and I'm thinking, why is my left knee and then my left hip? And then I did a class with, I recorded a class with Dr. John Bergman, who is a very famous chiropractor, and he said, Lily, it starts in the bunion. You need to look at the toes, the feet. When you talked about the feet, it's all connected. I'm like, oh, I got to introduce you to Dr. Claire Stagg.
so, so remember, everybody works in their wheelhouse because
Yeah,
that's what we know.
yeah,
All right. I like to think that I have a little bit of everything in there, and what I can't know, I don't. I refer to whomever I think would be the best served that will work better with their wheelhouse and their knowledge. So if you start with a foot person, everything's going to be a foot thing. If you
yes,
start with a neck thing, everything's going to be a neck thing. If you start with a dentist, everything's going to be teeth. If you start with a hip, everything's going to be hip. The whole thing is to connect everything together and to gather the parts and to make sure that you understand which is the primary cause. The bunions could very well have been an ascending case if that was the case, right? Remember we talked about that? But remember when we did the autonomic test where I checked you to see if you were in dystrophy, when I checked you to see if you were TM primary, I did the test, the neurological test, the motor neural reflex test. That's why as dentists, we do neurobiological engineering. We're the only ones who really can treat a jaw joint because we have we can put all our hands on all the different parts of this joint. You understand? They
yeah,
can't. The chiropractors can't. The massage therapists can't. The PT people can't. I mean, nobody can do everything. We can work with a capsule. We can work with the tendons. We can work with the joints. We can work with the actual muscles. We can work with the teeth. We can work with the nerves. We can work with everything. Once we know what to look for and what to do.
yes, yes.
So
Well,
yeah,
no, I have been fascinated by this whole process, and I'm excited that I get to share it with all of you. So Dr. Stagg, I know that we have about 3 minutes left in the classroom here. Uh, anything that you would like to share with our students in the classroom that when it comes to TMJ, maybe something that we haven't discussed yet? Is there anything that you would like to share?
I feel that there are a lot of people that the sensation I'm getting right now is there are a lot of people that are still lost and they're confused. And I think it's not necessary that they're confused, but they are being confused by others who are lacking in the knowledge of how to help them. Because there's Einstein always said, if you can explain it simply, you understand it if you can explain it simply. It's not it's not rocket science. So in the book, I have a massive amount of very simple explanations. I'm very big on analogies, and I literally sense when the patient's in front of me what they need to hear, what analogy would work best with them. And that's what the sense that I'm getting right now, and I'm maybe just picking it up from out there in the universe, I don't know, is that there's a lot of confusion. Remember, I started saying it was called the great imposter because nobody understands head, neck, or tail from this thing. And it's really simple when you understand it. It's like anything, it's really simple. But you've got to be your own advocate before you jump into surgery like you was such a drastic, irreversible thing, which may be warranted in some cases.
Yes.
But why don't you start from infancy? Why don't you start growing the seedling in the right direction? Get the right sun, get the right water, get the right wind so it doesn't grow crooked. I have patients that have one side that's 8 millimeters. That's 8 millimeters. longer than the other because they just grew that way. Well, we can help them. We grew bone for one patient 3 millimeters in 1 year. That's unheard of. And I know patients who've had massive amounts of growth with several years. So it's not doable. You know what I mean? Which double negative means it can be done. All right. So all I'm saying is read the book. You'll get a lot of insight. And the question and answer would be, I think, very helpful. If people want to deep dive more into the jaw joints, we can do that. But it is a doable help. You're not crazy. It is all in your head, but there's all different ways you can handle it.
Yes, yes. Okay, so I'm gonna do my closing with my splint because
Yes.
Dr. Claire would only allow me for an hour, so we've been without the sprint for more than an hour. Okay, I'm putting it on right now, and most of my pictures that you've seen me, I have the splint inside of me or inside of my mouth. But I want to remind you that if you would like to contact the office to maybe make a appointment for a consultation, you can call 321-777. 2797. I'm like, why do you have to have so many sevens?
I could fix that. Remind me the lisp. I could fix that. It just needs to take a little acrylic off where the tongue needs to sit. You just need a little bit more tongue space. That's all.
Okay, thank you. See, she's already I'm going to see her in a couple days. So, and you can
Yeah.
find her in Indian Harbor Beach. And once again, if you want to get a hold of them, you can call 321-777-2797. Yeah, my daughter says you sound like Sylvester the cat.
Okay,
Thuckering.
so did not everybody tell you you look younger and more beautiful too and more relaxed?
I don't know, but
Yes.
yes, you think? Does anybody
Yes,
out there
because
think?
your muscles aren't taut as much. They're more.
I have been saying to Dr. Claire that my face has changed a lot
Mhm.
prior to the orthotics, and I've been noticing more of a parasympathetic release. And so I'm excited. I hope that you will too. I hope that you took lots of notes today. I am doing something. This is an example of what we can do when you change your lifestyle. This has been a major change for me to be able to go out with this in my mouth and talk to people with this in my mouth. Sometimes I say, hey, I'm going through TMJ therapy for about 3 months. And so, and it calms, I'm not used to having things, not even braces in my mouth. So this is new for me, and it may be new for you, but check it out, reach out to Dr. Stagg, and get the book. Where can they get the book?
Yes.
At Amazon?
Actually, there's a link on Amazon. If you don't have a link, Vanessa will send it to you to put it on your site. But there's one on our site too.
Wonderful.
Did you know that we were #1 best new seller author when it first came out?
Wonderful.
In
Congratulations.
dentistry. Yeah.
And you will get so much more. So again, July 17th, YouTube channel is Health Connections Dentistry, and that's at 7 p.m. on July 17th, 7 p.m. Eastern Time. You're going to have a Q&A. Send your questions to pr@drclairestagg.com, or you can send them to me and I'll forward it to them. And please remember, you're in choice. You're always in choice. And this is Lillian McDermott and Dr. Claire Stagg wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. You're the best. You're the best.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.